As I mentioned, backaches can crop up as your stomach grows because the muscles in your back connect to your spine to hold your stomach in. Many of your muscles and ligaments are now being stretched as your belly grows. At the same time, relaxin and progesterone are causing your tendons and ligaments to soften, which can put additional pressure on your back. So during your pregnancy, especially starting in your second semester, you want to be very careful to use good posture at all times. And that's because you want to be upright. And some of the things that we suggest are, instead of reclining on a couch or in a recliner chair, starting in your second trimester and for sure during your third trimester, you want to make sure you're sitting upright or even slightly forward. The main reason for that is it'll help you from the perspective of back pain. And second, it'll help ensure that your baby gets into the optimal position for birth, which is head down, facing back towards your spine. If you sit in a reclined position a lot, I mentioned, baby is usually in a breech position or moving around quite a bit during your end of your second trimester and definitely during your third trimester. The majority of babies then turn head down so that they're prepared for birth and are engaged in your pelvis. And that's really important. And you want your baby to turn head down facing your back. Unfortunately, in Western culture, where sitting in a reclined position is more common, there are increased number of babies that are what we call sunny side up or posterior. And that means that they are head down, but their face is pointed the same way yours is. They're kind of looking at your belly button instead of looking at your spine. And the problem with that is that means their head is in the wrong position to be able to easily slide under your pubic bone during birth. And so to minimize pain during labor and to make your birth much easier for you and your baby, you really want to maintain an upright posture at all times, especially towards the end of your second trimester and during your third trimester. One of the things you can really do to help yourself if you find your back hurting a lot is to do the cat stretches that we talked about earlier. By arching your back, letting your head fall down and envisioning your belly button pulling up towards the ceiling. You do a combination of tightening your muscles, so you're keeping your muscles tight so they can better support your stomach, your growing belly. At the same time, you're relieving pressure on the discs of your back. And so by doing that, you actually increase the fluid going to your discs in your back, by the cat stretching. And at the same time, you tone the muscles. And so that's a really good exercise to practice, not only to prepare you for to relieve backache, but also to prepare you for labor and delivery and help your baby get in the best possible position for birth. Try to stand for a short period at a time. So being upright standing with your knees locked and your weight evenly on both feet is what you want to avoid. What you want to do instead is be walking, which means you're rolling back and forth, and the movement of your pelvis and your back, that actually helps increase the fluid and circulation, which helps with back pain and to move things around. So you want to do that, but you don't want to stand with your knees locked. If you're at a social event or if you have a job that requires you to stand a lot, at least try to elevate one of your feet, put it up on a step or on something, and shift your weight back and forth. So you have the majority of your weight on one leg, then the other, and you're going back and forth. The other thing that can help with backache too is replacing your work chair. So if you sit a lot for work, replacing your typical office chair, which often allows you to recline too much, with a stool or a birth ball or something that really encourages you to sit perfectly upright on top of your pelvic bone, so you feel like there's a string kind of attached from your head going straight up to the ceiling, where you can sit in that position with your legs spread. That's the very best thing to do. And by legs spread, what I mean is, as your belly grows, instead of keeping your legs in the polite, socially acceptable position with your knees together, you don't want to do that, because keeping your knees together pushes your belly up into your back and up into your lungs and diaphragm. And You don't want to do that. This is the time of life where you want to go ahead and let your knees spread apart and let your belly come forward. At the same time, you envision a line from the bottom of your spine, from your tailbone all the way up through the tip of your head, going straight up to the ceiling. Almost imagine like there's a string there that's pulling you straight up. That's the position you want to have while you're sitting. And swapping out your office chair for a stool or a chair without arms that encourages you to keep an upright posture, and by using a pillow or one of those office pillows they often have for people with back trouble, or even a wedge under your buttocks that help you maintain that upright position is very helpful. The other thing is, if you notice that your back's getting sore, go for a little bit of a walk. That can help a lot. And when you get home, have a nice bath. Soak in a warm tub. That can make a big difference as well. If you're into essential oils, I really enjoy mixing lavender oil and or some combination of marjoram, rosemary, wild orange. Those are all wonderful oils that you can apply directly, or my favorite is to actually have those massaged into my lower back by my husband while I'm pregnant. And so just taking a little bit of fractionated coconut oil, almond oil, and then having a couple of drops of whatever suits your fancy. I really like lavender in particular, not just for my back but also rubbed into my belly. It's wonderful for preventing stretch marks.